Hello, it's Dr. Paul Bekkum from All Seasons Full Body Chiropractic Center. Today we're going to talk about drug-free treatments and why chiropractic first. Why would you want to pick chiropractic as the first place to go rather than going to a medical clinic to get non-steroidal anti-inflammatories and some of the other medications that they use for treatment of neuromusculoskeletal conditions. So again, today I have kind of the graphic up that I use in the office to try and give people a good idea of the different tissues and things that we deal with here, and how it affects us and how it's going to affect your treatment while you're here in the office. So first of all, with drug-free treatments or even drugless treatments, if you want to think of it that way, we have tons of things in the office here that we use that work as effective or even more effective than medications that are out there. And there's several studies that even prove this to be so. One of the conditions is neuropathy, something that we have patients walk in the office with all the time. I'm going to try something here. Everybody just let me know. I have a laser kind of pointer. We'll see if that actually helps. So like in here we have the nervous system. I don't know if it's showing up at all or not. But people who have issues with their nerves, could be from diabetes, could be from some nerve conditions, could be some toxic effects from different drugs or chemicals that they've been exposed to. They can get some abnormal issues kind of showing up with their nervous system here. I have my mouse kind of moving on here now. I think my laser pointer wasn't working there, but the second image over from the left-hand side here, if you're just listening to the audio podcast, you might want to go out and just take a look at the graphic that's associated with the podcast here as well. So we have some different treatments that can kind of help with that. One would be some laser therapy that works really, really well, that people can get results in a very short period of time without having to take drugs, which might help deal with the symptoms, but they're not really getting down to the cause of the problem here. We also obviously have the regular chiropractic treatment, not only to the spine, but also to the extremities. We have several screening tests that we use in the office here to help determine exactly where is the cause of the problem, so we can get that problem fixed and resolved for you here. I guess a big thing to kind of look at here, I know there's a big study going on by Kaiser out on the West Coast, but it might have some far-reaching effects here across the United States. They're studying whether or not chiropractic should be the primary care provider for people that have neuromusculoskeletal conditions. They haven't released the study yet. I think it's due to come out in 2018 sometime here. But what they're finding and some of their preliminary findings is that, yes, chiropractic should be the primary care provider that anybody that has a neuromusculoskeletal condition should go to. And then they can get referred out from there if they have something that a chiropractic office can't help deal with. But the biggest finding that will get published here is that they found just in their market where they're at, it's going to save them $2 billion just for having patients go through a chiropractic office rather than go through a traditional medical office. And I guess some of the big findings that they also found is that even right now, patients who are going the traditional medical route, a lot of them do end up in chiropractic offices, acupuncturists and all that. But they've already seen somewhere between 8 to 12 providers before they even get into a chiropractic office or an acupuncturist office. So that's where a lot of the costs go up. You've probably already had MRIs, which found nothing, or maybe they did find something, but it could probably have been taken care of already with chiropractic care or acupuncture type care. A lot of times these people, might even been sent out to see if they're even surgical candidates. So they've had consultations with neurosurgeons or orthopedists to see if surgery might be a solution for them. And, the vast majority of them, it's not going to be a solution. So the ones that do need it, obviously then they've kind of gotten to where they need to go. But it's cost a lot to screen through all these patients when they probably could have already been taken care of with, some drug-free, kind of surgery-free care that costs significantly less than, most surgeries are at least 5 figures. Some are going to get up into the 6-figure range there. So significant savings, just to go into a chiropractic office and get much better results with less side effects. Definitely not going to get the toxicity because you're not going to get, the side effects from medications such as the non-steroidal anti-inflammatories, which everybody takes. And please just make sure yourself, read the bottles. If you read the side of the bottle, you're supposed to be taking them for upwards of 2 weeks. And then you need to literally stop taking them and see a physician to see what else can be going on here. So sorry about that. Got to interrupt you for a second. Trying to get something set here. We'll see if we can we'll keep the graphic up here for now, I guess, but we'll keep going into it a little bit more here. Big things that also kind of come up, what are some of the treatments that we have? If you look at the image, on the screen, on the far left, you have the skeletal system. A lot of that is going to get dealt with more with some of the chiropractic care. I'll try and go over some of the drugless kind of treatments that we have in the office here. Also, that can be affected by ultrasound. There can be some deeper treatments that can help with that as well. PEMF therapy can help with bone healing, although the PEMF therapy, which is pulsed electromagnetic field therapy, is really geared towards the kind of third image in there on circulation. It's FDA cleared to help improve the circulation in the body, especially in the arterioles, where you're getting down to a vessel that just has the size enough for one blood cell to get through at a time. And there's some pretty interesting visual studies that they've done over in Europe, in Germany actually, where some of the equipment was derived, and it can show you just how the blood flow increases there. So a lot of patients that we have, if they have some kind of chronic aches and pains, using the PEMF therapy there can be super helpful in improving the circulation and also helping in just decreasing pain, mostly due to inflammation that a person might have going on in their body. So some other therapies we have in the office, we have some vibration therapy, whether we have something called a vibracussor. The doctors or staff would use to help kind of relax the muscles. Typically it's set somewhere in the 20 to 30 hertz range, which, patients that have things like fibromyalgia or trigger points, it helps to relax the muscles, get the muscles down to their normal tone, which can significantly help in reducing the amount of treatment that we need to do with people here. Makes it easier to get people treated as far as getting them adjusted, getting their bodies and their skeletal systems lined back up where they should be at there. And it also helps just the patients in general reduce the pain and improve the function of their body there. There's also a vibration plate that we use with people where we can literally do some rehab exercise on it. Kind of an interesting thing. Some people, if they're having areas where they're having pain or discomfort, they'll literally have just all the muscles kind of kick in when you're using the vibration trainer there. So if there's an area that's significantly weak, a lot of times you're going to be able to do those exercises rather than not being able to do them at all, or you're literally going to be able to, do more than what you could without having to use the vibration trainer there. Other things, that we use in the office are different things that help stimulate not only the nervous system and the brain and spinal cord there, like balance boards and rocker boards, helping to restore the appropriate balance to the muscles and the bones and joints. Again, so hopefully long term, we're making this person much, much more stable, and they're having less issues with just muscle tension and from basically misalignments. And by utilizing the rocker boards, wobble boards, the vibration trainer. We're getting everything kind of evened out so that their body can help, start to strengthen, start to stabilize itself, and have a really good base to build on. And then they can get into a really good rehab program to help strengthen the areas that are kind of weakened and restore the appropriate balance and alignment to everything here. So now we get into some other therapies that we have. Some of the other traditional ones we have, electric stims that help deal with inflammation, help deal with pain. Also, we'll get deep down into the joints. A lot of people do different breathing exercises. Some of those we'll maybe get into on a future video here too, how you can start to perform some breathing exercises and how that can help you start to breathe better, help get better oxygen out to your tissues and all that. That's one of the initial things that we want to get people going on here so that they can just be utilizing their body's natural healing abilities to be able to restore itself to normal there. Other things we do go over in the office here are different nutritional things as well. Typically, we like to kind of use a questionnaire so it kind of helps narrow down where a person does have problems at so that we can get you going on a more natural basis, whether it be with supplements or changing your food items there and making sure that you're not putting things into your body that are hurting you and that they're there to help you there. Tons of other therapies and get into different things with people that have sciatica, radiating pain in their arms and legs. There's some traction therapy that we have that helps to remove the stress or tension in the areas there and reduce the radiating symptoms. So rather than jumping to something like a surgery to help correct a disc problem, there's probably 10% of the population that have disc problems, whether it be a disc herniation or a disc rupture, unless it's facing a nerve and causing some significant weakness, or you're starting to get what's called a cauda equina syndrome, where you can't, start or stop going to the bathroom. Nobody wants to have either of those situations there. You want to have everything functioning normally. That would be actually an emergency situation that needs to get sent into the neurosurgeon right away to get that decompressed, to get that nerve function back as soon as possible there. So I've only seen it in a couple of cases over 25 years, although, it is something that does happen. It's very, very infrequent. So we can kind of go on and on about other therapies here, but those are just some of the things we can do in the office. There's plenty of things you can do yourself at home. Should you have questions on anything that you might have going on, you can always go to our website. And let's see if I can get this back up here again. I will try and